Everyone talks about what is possible when it comes to AI and what is the future of healthcare, the future of healthcare insights going to look like. And I just think this democratization of generating important insights that inform enterprise decision-making that can help, patients be more proactive in managing their own health. I feel like we're at a very important shift in how we're going to be empowering different people at all levels of the enterprise, across all levels of the enterprise, and empowering patients themselves just to take a much more proactive stance to driving better outcomes for themselves.
New choices, new players, new models of care. Consumer-first healthcare is everywhere. For us to build the future, to see what's new, we gotta look at the world from a different point of view. Consumer innovation ain't going away. I say it's here to stay. Today it leads the way. We gotta drop the silos. We're all the same team. Experience, business, tech, and marketing. So join us now. Join the revolution. Consumer-first health is the evolution. Status quo or like status no. Yeah, this is the healthcare rap. Yo, come on, let's go.
Welcome back to the leading podcast about consumer-centered healthcare, y'all. What if healthcare was actually centered around what consumers need and expect? Here on this podcast, we're talking with leaders who are making it happen, one experience at a time. I'm Jared Johnson, and this is episode 386. Today, we have the Flava of the week about the head of Function Health campaigning to integrate nutrition into medical school training. Can you imagine a future where your doctor prescribes nutrient-dense whole foods instead of another pill? I'll talk about that. Then we welcome Webb's son, president of Komodo Health, to talk about outsourcing complexity, turning lagging indicators into leading indicators, and democratizing insights that help change the game for consumers. It's time for the awesomeness, y'all. Are you ready? Let's go.
Flava of the week.
Lately, I've enjoyed learning about preventive health points of view, which is probably why a recent post by Dr. Mark Hyman from Function Health caught my eye. He shared a vision and a call to action that aligns with where I hope healthcare is going. This is what he said. Imagine a future where your doctor prescribes nutrient-dense whole foods instead of another pill. That vision just got a major boost with a groundbreaking consensus statement in JAMA, or the Journal of the American Medical Association, outlining essential nutrition competencies to integrate into medical school training. The competencies would be included in licensing and board certification exams, equipping doctors to prevent, treat, and reverse chronic disease using food as medicine. Dr. Hyman then said, "This is a cause close to my heart and central to the work I'm championing with the Food Fix campaign. We're pushing for updates to the NIH Nutrition Curriculum Guide, launching a medical school curriculum initiative, and advocating for tying federal grants to nutrition training. By making nutrition a cornerstone of medical education, we can equip doctors with the tools they need to combat the chronic disease epidemic." Close quote. Now, I spent a few minutes looking at the actual consensus statement in JAMA, and the key question was, what are the essential nutrition competencies that should be taught to medical students and physician trainees? And the research found that through a modified Delphi process, an expert panel reached consensus on 36 nutrition competencies to recommend at undergraduate and or graduate medical education levels. Participants recommended that nutrition competencies be included as part of licensing and board certification examinations. The meaning of this is that the identified nutrition competencies will require institutional prioritization, revision, refinement, and expansion over time. I hope we talk a lot about this, a lot more. We've heard throughout this season that historically, medical training includes a lot of meaningful information, but little to nothing about things like nutrition, sleep, fitness, and weight loss. And that makes sense given the emphasis of traditional medicine. It also led me to ask, is this the next mission worth focusing on as we look to turn healthcare into a new version of itself that more directly addresses the base feeling of wanting to feel well? I'm saying an emphatic yes, and more statements like this one from Dr. Hyman are bound to help. Let's bring more preventive points of view into our discussions about making healthcare more consumer-centered, because by now we know exactly where sick care falls short. That's another way that we'll build the healthcare of tomorrow, and that's the Flava of the week.
The flow.
All right, everyone, let's get into the flow. Please give it up today. We've got Webb's son, president and co-founder of Komodo Health. Webb, welcome to the Healthcare Wrap.
Thanks so much for having me, Jared. Really looking forward to today's discussion.
Can you tell us something maybe that most of our listeners might not know about you?
This will be a fun one to start off with. So Jared, I noticed in some of the notes here that one of your side hustles is doing a little rapping, but I'll say it's been over 30 years since I was asked to spit any bars, but in high school, I was voted by my graduating class as most likely to become a rapper. So although that hasn't really played out, maybe someday at one of these HLTH conferences, you, me, Busta, Luda can do a little healthcare rap.
Let's make it happen. One of my favorite fun facts we've had so far. It's like riding a bike, I'm told. So, we can just get right back on that. So we'll keep that in mind for sure. I love it. Well, I'll tell you what, you mentioned HLTH, so the health conference, right? There were a couple of things I know that the Komodo mentioned there. And I know some of those things had to do with just some of the responses to some general trends out there. But I think a good starting point for us, because I want to hear about what some of those new innovations are that Komodo has announced. And I think kind of a good entry point for that is just the fact of what health science, or what life science companies are facing out there right now. These market dynamics keep changing. I'm curious what you're seeing out there. Like, what are some of those challenges in general that life science companies are facing in the market? Just help level set for us, and then I want to dive in.
Yeah, I've been in healthcare and life sciences with an overweight on life sciences now for over 3 decades. And I think you see a number of factors, whether it be IRA, whether it be macro, whether it be interest rates, that are leading life sciences companies to talk about doing more with less, getting more efficient, managing outside spend better. We joke internally that executive teams are saying, we need to get smarter, faster, and more efficient. And this time, we really, really mean it. And, to that end, it's about, for us, it's really about overcoming the status quo and the mindset of what we refer to as good enough. Right? In this day and age, good enough isn't good enough. Our healthcare system and our patients deserve better. The running joke in industry is you'll spend $1 on data and spend $11 trying to extract the insights and value out of that data. And, it's wild to me, despite the massive amounts of healthcare data that's being generated every single day, the industry itself still struggles with outdated, time-intensive, resource-intensive, ineffective processes to turn that data into insight. And so just as one example of a recent case study, earlier this year, Frost & Sullivan's published a study, and it really highlighted challenges working with real-world data across the entirety of the life sciences life cycle. And so, some nuggets for the listeners here, Frost & Sullivan found that approximately 70% of life sciences teams that were surveyed spend over half a year just working with the data, transforming the data, bringing it together to get it to a usable state where they can begin the analytics process. And so, as you can imagine, that delays everything, whether it be enrolling clinical trials, whether it be commercializing those assets. That's just one example. I think the other stats that stood out to me, the majority of life sciences teams end up purchasing data from over 4 different data providers to gain the depth and diversity of insights that they need to drive decision making. And then the majority of life sciences teams rely on at least 4, if not more, consultants to help them start integrating the disparate data sets. And most of them spend time with up to 6 consultancies doing analytics projects against those integrated data sets. And so what that tells me, these statistics, these insights really point to a broken insights generation workflow and a need to this was the inspiration for starting Komodo, right? We wanted to put together and build a company that operated at the intersection of data and technology so that we could enable users, all kinds of end users, to get rapid, repeatable, novel, high quality insights at scale. And that's where the industry really needs to go next in terms of finding an easier way to uncover and share insights into disease trends, treatment pathways, patient journeys across different patient populations, all kind of generated and powered by a single source of truth via a platform that can be really deployed across the enterprise.
Okay, so a few different threads to kind of pull on there, right? Well, let me start with one I think tends to fall a little lower in the conversation, but let's talk about something like health equity. So thankfully, we have a lot more attention on health equity these days, but how can a tech platform like Komodo's help bridge gaps in care and address particularly underserved populations?
Jared, we always start with, you can't change what you can't see, what you can't analyze, and what you can't measure. And so at Komodo, we've built the industry's largest healthcare platform containing anonymized real-world insights on more than 330 million patient journeys, where we're tracking individual discrete patient journeys across every encounter with the healthcare system. Think about it like this. everyone that you know, you and I also are represented as an anonymized, de-identified token in our healthcare map. And we track each one of those tokens across every touch point with the healthcare system. When you see your PCP, when you go to CVS to fill a script, when you get sent down to Stanford to get a stress test, something like that. And so when you think about that level of detail, and then you add on the fact that over 2/3 of the patients in our healthcare map are fully characterized on a series of patient-level features, including demographic data, race and ethnicity data, socioeconomic factors, et cetera. These kinds of insights help researchers and other healthcare leaders identify trends and make decisions to improve patient care using a patient-centric focus. As one example, in real time, our partners can see where standard of care is and isn't being delivered across the entirety of the healthcare system, across disease areas, across settings of care, across geographies and zip codes. And this provides all of us with the visibility and understanding of whether or not we're doing everything we can to reduce disease burden. You think about the platform and what we're able to power. In addition to that use case, you think about clinical trials. I'm going to use oncology in this example. We've all seen the stats on the percentage of patients that are enrolled in clinical trials, in oncology clinical trials, that represent underrepresented groups. And so if you think about that and being able to spotlight where you have patients that are treatment naive, that have a specific set of conditions or comorbidities, and that haven't been enrolled in previous clinical trials, all of a sudden you can use that to kind of spotlight geographies where you can enroll patients that are from underrepresented patient populations into those clinical studies. And so, when you think about it, to address these kinds of disparities in care delivery, in clinical trial design and patient enrollment, we really need to understand where we can best point our solutions. And that will allow us to increase access to care, treatment, increase access to, better quality insights. And I think with visibility into millions of healthcare journeys, Komodo helps unearth trends that have been insufficiently studied, or in many instances, even gone unnoticed.
Okay, so a couple of things I heard there. One is data being patient first or patient centric, and that resonates a lot. We talk a lot about how to design care that is consumer first. So very similar and is, if anything, is even broader of what types of care, what types of health and wellness somebody is seeking. So when I hear a term like data being patient first, my ears kind of perk up. And I think, how can we actually design better experiences without that? Like, it doesn't work unless the data is actually patient first as well. And I don't think we talk about that enough in other circles about like what that even means, how to actually execute, what data is actually being fed in to understand what journeys are happening and how to influence them and guide them. And it sounds like that sounds like it's similar to the mission of Komodo, which, on the website is to reduce the burden of disease. So this ties very much to not only underserved populations, but to everyone. It sounds pretty universal. Am I understanding that correctly? Just the part about data being patient first? And if so, is there any more color you can add to that?
Absolutely. I'll go back, first of all, to where you started, which is, how do we think about health equity? And when you think about health equity, to drive better health outcomes for underserved, understudied communities, you have to be measuring where disease burden sits in the population, who is getting reached for treatment and who is being left behind, who is and isn't receiving standard of care, where diagnoses and proactive patient management may be lacking. To do that, you have to be able to look at not just one of those kind of population health levels of insight, but also be able to pinpoint specific populations. So when I go back to it and I say, we track 330 million patients across every encounter with the healthcare system longitudinally. We have 2/3 of those patients fully characterized on patient-level features like demographic data, race and ethnicity data. All of a sudden, that creates the ability for us in the platform to say, help me define a patient population that has this set of characteristics, and then I can very transparently assess whether or not they're receiving standard of care and how that may or may not differ across different patient populations, across different geographies, across different payer plans.
That's the foundation of all this then. So then when we start talking about some of the other outside influences that are impacting how we're able to implement some of these data strategies, thinking about things like policy change, like drug pricing reform, value-based care models, how do you foresee that intersection influencing the way that we can use data in some of the ways you just described?
Data-driven decision-making is a non-negotiable in 2024 and beyond. right? I mean, we've been talking about value-based care for how long now? And so when I look at it, I say, there's a lot of data vendors who can share data with their end customers, and then the end customers have to figure out what kind of insights can I generate off of, my data purchase. I think partners who can show ease of use and decrease time to insights in the future are going to win out. And, as we look at it, we're going to continue to see LLM advancements democratizing access to the necessary insights for business leaders and their support analytics teams. I mean, you look at it, we talk about how pharma is seeing increased competition across every category, right? 20 years back, there were only one or two players in oncology. Today, every top 30 has a franchise and a whole portfolio of assets in oncology. When you look at something like, just take a look at what's happening in the race to the next hot therapeutic category. Take a look at what's happening with the GLP-1s. Can you imagine what a few extra months of being first to market would have meant to the parent companies of the first GLP-1s, to their patients? Now, can you imagine delays in enrolling those patients, corresponding delays in FDA approvals, and what that would mean to future entrants into this category? And so, as the entire healthcare system seeks to better manage costs, to better align investment with improved patient outcomes, knowing when and how to intervene in a patient's journey, whether or not that leads to improved patient outcomes over time, that's going to be an incredible lever for healthcare decision makers to make better decisions around everything from product development to care delivery. Just from a life sciences point of view, they're going to need the ability to see where that next white space might exist, where their competitors are projected to focus their efforts in the coming years, and really figure out how do they accelerate their initiatives so that they shorten the timeline to getting new breakthrough treatments into market.
Let's shine a light on that a little bit more. And when we talk about that real world data you're just mentioning, how do you see that evolving over the next few years? We're talking about the rise of so many different AI-powered tools. Komodo's announced a new ChatGPT-like tool yourselves. Where do you see things headed from here?
For starters, real-world data powers real-world, real-time insights. And at Komodo, we believe that AI has the power to help us get to insights faster and deliver on our mission to reduce the burden of disease. And so, Jared, I appreciate the spotlight there. This past month, we launched Map AI, which is a no-code ChatGPT-like tool that allows anyone, regardless of your technical skills, analytic skills, you don't have to know how to run a SQL query. Anybody, any persona within a healthcare organization, or anyone who's interested in studying patient cost and outcomes can evaluate drug trends, study disease populations and disease progression, can evaluate how patients are being treated and more in seconds versus hours or days. And I would say it's been really incredible. With this new technology, we're enabling teams to use conversational AI for rapid exploration into patient journeys in an easy-to-use, no-code environment. And this is the future of real-world insights that are accessible, transparent in terms of how the disease definition was created, configurable, shareable across different teams in the enterprise. And that's really going to power better insights, better outcomes. And so when we talk about it, real world data in real time at scale powers real world insights into what's happening across different disease cohorts, different patient populations. And it's incredible. As you think about 2024 and beyond, it won't matter whether you know how to code or not. You can get the answers you need at your fingertips to drive decision-making and power improved patient outcomes. Just as one other example here today, one of our data engineers, full stack engineers today, as part of Career Day, was invited to talk to STEM high schoolers interested in exploring future opportunities in healthcare, whether it be going to med school, whether it be going into health informatics. And the beautiful thing was he was letting high schoolers use Map AI, and all of their minds were blown. They were using it and they were saying, help me understand, I have to do a project on this disease area. And they're going right into the interface, natural language querying of the healthcare map. And they're already getting insights around epidemiology, disease progression, how patients are being managed today. And they were doing it completely in a codeless environment.
I'm not as surprised about that because I've heard, so I have a son in college and he's in an engineering program and I'm trying to steer him towards biomedical, but that's where my passion is. But he was just telling me the other day that he had a particular class this year and the professor, he wasn't understanding the professor very easily. So he'd go home after the lecture, ask ChatGPT, or he had like three different tools, and some of them are better than others, but he would just say, hey, can you explain this to me like I'm a fifth grader? And then he's like, okay, now I understand what my professor's talking about. Like, it's mind blowing for those of us who didn't have things like that. And we know when we were that age as part of our education. So I can see it like it's just going to keep evolving. It's fun to think about it in some of these real world data in real world situations. But, as I think about a couple of other aspects of this, again, there's so many implications to what you're describing. And I like the fact that this is not a destination yet. It's definitely a journey in terms of what's possible, what you're providing by evolving the way the data is available to people. To that end, what are some specific types of data when you're talking about a healthcare organization that they can use to drive some of those improvements in a consumer experience? I think this is where we help our listeners understand the more direct consumer applications of this. And the background for that is this desire that we talk about a lot on the show of not having to outsource healthcare's complexity to consumers or patients. They tend to not care as much how complicated something is. They just want to know, in their case, what's the data that impacts me? Why is it so hard for me to find it? Why can't I get it? Where is it? Who owns it? Why can't I just find out the stuff that's pertinent to me? So they just want to know it. They don't care the fact of, who all, the stats that you shared at the beginning were perfect. They don't care there were 5 consultants, but that's the reality that the healthcare organization is dealing with to actually get the insights they need. They're the ones having to figure all that out. And then they have to translate that and turn that around and say, well, here's why this matters. Here's why this new approach, here's why this new tool, here's why this new platform matters. It's because we can improve the way that you're interacting with us through it. And then they have to get specific. So like what are some of those more directly consumer facing applications of what you're saying? Because it has to be there. And half of it just seems to be being able to explain that value to the person who's being cared for.
We always start with, what is the question you're trying to answer? What are you trying to solve for? As we've built out the platform, as you can imagine, we have such a richness of real world data powering our real-time analytics that it's interesting because it's kind of challenging. We have the blessing and the curse of really almost being able to solve for anything, right? And so there's so many different use cases that the platform can be pointed at. So we really start with what insight is missing. And so we get engaged all the time. Hey, I've got this social determinants of health data set, and I want to know, can I join that into the healthcare map to power additional insights? We have other companies coming to us and we've got wearables data. We've got genomics data. We've got genetic testing data. We've got lab data. We've got EMR, EHR data. Can these assets been joined into your healthcare map, where you have a foundational platform for patient level insights, patient level analytics? Of course, we can do all of that. But first, you have the rationale for what you're trying to solve for and how bringing these assets together will unlock new understanding of disease, new understanding of what's possible in a given patient population. So you really have to understand the use cases that you're solving for. Now, taking that a step further into a consumer point of view, you talk about patient self-reported outcomes versus something that's as easy to use as an Apple Watch, right? And so we have had partners come to us and say, hey, we want to be able to track patients that are on this treatment regimen. And really, we want to better understand, are they actually feeling better on a day-to-day basis? Because by the time I've seen them 3 months from now, or 6 months from now, or 12 months from now, that is then a lagging indicator of whether or not this treatment regimen is helping them. But in real time, I have patient self-reported outcomes being tracked on a daily basis via something like a journal, a patient journal on their Apple Watch that just says, on a scale of 1 to 10 today, how are you feeling? All of a sudden, that bit can become a leading indicator for better understanding. Are those patients doing well? Are they doing poorly? And then you have a leading indicator going to your next patient encounter that can potentially inform, do I switch them off therapy? Do I change the dosing? Do I do something else, et cetera?
Yeah, so I could go down this road a lot. That's a use case that makes sense to everybody. I think that's just really clear. The self-reported data continues to evolve from different tools and different players that we speak with as well. That's the intersection. The light bulb just went off, and I think it's great to be able to understand. We're talking a lot about what's possible now that wasn't always possible. And to that, I wonder, as we start to conclude here, if there's any other piece of this conversation we haven't talked about yet that you want to make sure our listeners hear.
We are on the cusp of, everyone talks about, what is possible when it comes to AI and what is the future of healthcare, the future of healthcare insights going to look like. And I just think this democratization of generating important insights that inform enterprise decision-making that can help patients be more proactive in managing their own health. I feel like we're at a very important shift in how we're going to be empowering different people at all levels of the enterprise, across all levels of the enterprise, and empowering patients themselves just to take a much more proactive stance to driving better outcomes for themselves.
All right, that was a great way to kind of tie in several different aspects of the story that we've been talking about. So, Webb, I've got one more question for you, which we've had. I have to say we've had some really interesting responses on this. So, I like asking if there's a guest that you could pick for us to invite on a future episode. Who would that be? I will say it doesn't necessarily have to be somebody that you could introduce us to, but somebody who you'd want to tune in and hear us speaking with.
All right, it's November. We just went through an election, and regardless of where you stand on politics, I would love to hear a podcast with Dr. Ezekiel Emanuel and or Nancy Ann DeParle and or Senator Max Baucus. And the reason is because, you think about what's happening across the country. There's been so much disinformation out there regarding the Affordable Care Act, aka Obamacare. And as three of the principal architects behind the Affordable Care Act, I would love for them to come on and share facts around the rationale for how ACA was designed, updates around how it's impacted our healthcare systems, and facts and figures around the ways it's benefited everyday Americans, because I think that was such a transformative piece of legislation. And it would be really interesting, exciting, and powerful just to get three of the principal architects to come on and talk about why they did what they did and the way it's helped Americans and helped improve our healthcare system.
Fascinating. Definitely have not had that response. What a timely answer to that. I love it. No, we'll see if we can make that one happen, because that would be a big one for sure.
I would tune in for that for sure.
We'll see what we can do on that one. And in the meantime, I just want to thank you for joining us. That's a wrap for this episode. It's just been an absolute pleasure to speak with Webb Sun from Komodo Health. Thanks for joining us today.
Thanks so much for having me, Jared.